Hello, hello, welcome. I am so excited to be doing this video for two reasons. One, because well, I've never done anything like this and I'm excited for this to be maybe just another avenue for Bourbon Blonde. But two, because I know I am not the only one when I say this whole skincare thing is such a mystery to me, and I'm sick of playing the guessing game. I'm sick of just stumbling through trying to figure out what I need to be using, how I need to be using it, and what order I need to be using it. So I am thankful for all your questions. So many questions that I hadn't even thought of. I'm like, oh, that's so brilliant. So thank you for those that sent them in, and we're gonna get all those questions answered and get all the knowledge. I am here in Cary, North Carolina at Bodylase, and I am here with Tiffany, who is a medical esthetician here. It's actually my esthetician as well, and she's been getting me started on my skincare journey. We recently did a microneedling treatment, which was like life-changing, no joke. But there's so many other aspects to skincare, and again, I want to make sure we have the lowdown and we've got everything we need to know so we can be victorious in this journey, right? All right, so let's get into it. Before we start questions though, I would love Tiffany to just tell us a little bit about herself. And I know you've been in the game for what, like 10 years or so? So you've been in a minute, right?
Well, I mean,
you
like
know a thing or two.
A couple minutes.
At least a couple. So how did you get into it? What inspired you? You know, how did you end up in this field?
I've always been freckly
I'm really
and
sorry to cut it, but you can really tell you truly know.
damn it. So I've always been freckly and moly ever since I was little, and I started going to a dermatologist. When I was about 17, they found melanoma on me, and so from then I had to have tissue removed in that area just to make sure it didn't spread, and I was more like, ooh, I want to see the inside of how this is all happening, and so I was more interested in it from there, and then still went to school for different things, but ultimately went back to skincare.
Very interesting. So you're one of those people that like you don't get grossed out by those things.
No.
Me, I see anything like that and I'm passed out on the floor. I can't handle it. Let's get into questions, shall we? So there are so many things when it comes to skincare. I mean, we've got products, we've got procedures, and there's BOTOX, and there's fillers, and there's this, and there's that, and there's this, and there's that, and there's so much. It can almost get overwhelming if you're trying to navigate it by yourself, which is why I'm so glad we have you. Teach me all the ways, right? So one question that I got so many times, and this is something that I also have had a question over, is just what products we need to have in our arsenal. I know as a woman in her 30s, looking back at my childhood, I was never really taught the proper way to take care of my skin, how to cleanse it properly, how to moisturize it, exfoliate, I mean anything. We were sunbathing in like baby oil. I think you even said was your grandmother was sunbathing? Motor oil. That blows my mind. So obviously taking care of our skin was thought of differently back then. So, you know, as an adult woman, I am in the dark, and I know so many women my age or even in their 40s, 50s were in the dark. So I've heard we need an AM routine, I've heard we need a PM routine, but I don't know what goes in each routine, and then there's the order. So speak to that a little bit, just so we can at least have a game plan to start with.
Okay. So luckily people are starting younger, which is great because it's easier to prevent than to correct. So typically what you really want to have in your routine is prevention, correction, and then what did I say? In your routine, you typically want to have prevention, correction, and protection. So for prevention, usually like a vitamin C, a good antioxidant, and then protection, a really good sunscreen. That's probably one of the most important because sun can damage so much. And then correction, one go-to for me is retinol. Helps with the cellular turnover. So it depends when you use those. Typically retinol you want to use at night, so you correct more at night and then prevent more during the day. And then you want to think lightest to heaviest. So cleanse, and then like serums, eye cream, moisturizer, and kind of the same in the evening. So.
Okay, so the thicker the liquid, the farther down in the order it goes.
Yeah.
So that's kind of a general rule of thumb as far as the order that stuff goes in?
Yeah.
Okay. See, this is good stuff. I need to know this because I look at all these products and I'm like, I don't know what to do with them. I'm just gonna slap it on my face and hope for the
them all.
best. Right. I'll just make a concoction. Obviously, we don't need to do that. Yeah. Listen to the professional. Don't listen to me. But then you mentioned sunscreen, but like, is that something that I always need to put on? Like,
Yes.
even if it's cloudy or
Yes.
I'm not actively
even-
trying to be in the sun?
Even if you're, because a lot of people will say, well, I'm not in the sun, I work all day or whatever. But even in the car, you're getting all that. So a lot of people, when they do
Oh.
notice sun damage, it's always on this side that you usually notice it first, your hands. It's good to even wear it on your hands if you can remember. But so yeah, you always want to be wearing it, even if it's snowing. You want to.
Really?
Yeah.
That makes sense though, because light reflecting off the snow.
Yeah.
I didn't think about my hands.
I know.
But you don't want those age spots either,
I know.
so that's a good tip. That's a really good tip to know. So you mentioned incorporating a serum.
Mm-hmm.
Now, when it comes to serums, is that what the vitamin C is?
So with serums, it can be different things. So
Okay.
it can be a hydrating serum or a vitamin C serum. So some of them do different things. Usually with a serum, the molecules are smaller. It'll come more in a serum-y, more liquidy type form. So the molecules are smaller. They're able to penetrate deeper into the skin. So if it were a hydrating serum, I'll typically have somebody use that and then do a moisturizer on top of it. So it's kind
Okay.
of keeping that in.
Okay, so
Yeah.
you want to do both. That's a question I have sometimes.
Yeah.
If I'm using a serum that says it's hydrating or whatever, do I still need to use a moisturizer
Yes.
on top of that?
Yeah.
Okay, good to know. Awesome. When it comes to products, and I'm out in the market looking for products, and I see a whole ingredient list. I mean, that ingredient list seems like a novel
Right.
worth of stuff. What am I looking for? I mean, is there a rhyme or reason to the order? And if I see something in the ingredient list that I should stay away from, like what would that be?
Typically when you're looking, you want to look at the active ingredients. So
Okay.
whatever is at the top of that ingredient list. A lot of products will claim to have vitamin C or retinol. And I've noticed in drugstores, I'll look and usually at the very bottom of that list, it'll say retinol or vitamin C. So if it's at the bottom of that list, you're typically not getting a whole lot of it at all. Yeah. So you're kind of just spending your money on nothing.
Really?
Yeah.
Is it there at all? It's just a very
I
tiny
mean,
bit?
a tiny, tiny bit, yeah.
Not enough to do anything.
Right.
So you're always looking at the top. Whatever's at the top is going to be the strongest.
Typically with retinol and vitamin C especially, the way that it's formulated is reflected in the price usually. So you're probably going to pay more for your vitamin A's and vitamin C's.
Okay. But if it works, honey, you pay the money, right? Keep that skin flawless. That's a good tip though, because sometimes when it comes to skincare, you really do get what you pay for.
Yeah.
Now, and I have been guilty of this, but like ordering something off Amazon or just hopping in like, oh, it says it has this, but it's not that medical grade, or I'm not fully looking at the ingredient list. I'm just looking at some crazy reviews. Who knows if they're legit or not, but that's probably not the best thing to do.
So definitely you don't want to buy skincare off of Amazon. It's actually illegal for them to sell medical grade products.
Oh.
It has to be kind of overseen by a doctor, nurse. You don't want to, so people can change packaging. It could be expired. They could have tampered with it. So you're not really getting what you are cheaperly paying for. Just made up a word there.
That's a little scary.
Yeah,
Like the
because
thought
it's
of,
tempting. I know I have a lot of clients that are like, oh, I can find this for $20 cheaper or whatever on Amazon. I'm like, oh, I'm not trying to make you spend your money here, but
Yeah.
you don't want to.
you get what you pay for.
Yeah.
And if you're putting it on your face, I mean, your face is the first thing people see. You don't want to jack it up, right? So you want to make sure you're investing in quality products that are going to do the job that they say they're going to do.
Yeah. 80% of what you do is your skincare at home. It's kind of like going to the gym and, working out and expecting results after just one. No. So
That's true.
it's good. You can always come in for just a consultation and then kind of figure out down the road what you want to do treatment-wise. But yeah, it's definitely good to have somebody that can actually customize and.
Because everybody's different,
Yeah.
which is good. We're all made different. I want to ask you just a couple little fun questions. So if you could pick one product, and that was the only product you could use for the rest of your life,
Oh
what would that one product be?
That's hard. I would probably have to say sunscreen.
Okay.
Because the sun does most of the damage for aging, sunspots, things like that. So if you're not taking care of your skin that way, retinol, things like that aren't going to do much.
So if you're not putting that, literally like a protective shield over your skin, anything else you put on it, it's not going to matter.
Because you're just doing more damage with
The sun, we love it and we hate it all at the same time, right?
Yeah.
But that's good.
Hat,
good
sunscreen,
tip.
always.
Yes. Sunglasses. Yes. All of it.
Protective shield. if you
Right.
can.
Just the whole gamut, bodysuit,
yes.
whatever you got to do. But
Right.
you know what? Your skin's going to look great. Now, nobody's going to see it because you're going to be covered, but it'll look great. Next fun question. Your personal top 5 products, like what are your absolute go-tos that you have to have in your regimen?
Definitely Retin-A, which that helps with the cellular turnover in your skin. The younger you are, it takes about 25 days for your skin to slough off all those dead skin
Sloth, that's a
cells
good word. I like it.
on its own, and the older you get, the longer it takes. So the retinol helps with that cellular turnover. So that, and then I would say vitamin C, it's kind of like insurance for your skin. It protects, and it also helps repair damage.
Does it brighten too? Like help even out skin tone?
It helps with the collagen, so it's great for anti-aging. A sunscreen, a good eye cream, and then my 5th would be a hydrating serum. My skin's pretty dry on the dry side, so I like to do a nice hydrating serum underneath and then a moisturizer over top.
So that leads me to my next question. So you hear a lot about, oh, I have oily skin, or I have really dry skin. And that was definitely brought up more than once by those of you that sent in questions. How do we attack those issues? So if you have really dry skin, like you said, a hydrating serum will help balance that, right? Is there anything else that you would add on to that?
So with my dry skin, I usually have to do, especially in the winter, I would do a moisturizer over top of it and a sunscreen still. And then with oily skin, and with both skin types, you want to avoid like alcohol, anything that can strip the skin.
That's just a good rule of thumb.
Yeah.
Nothing with alcohol in it.
Because then you kind of dehydrate your skin even more, and you don't produce as much oil, so then your skin's like, wait, I'm not producing enough oil, and then it overproduces. So you want to have a healthy balance there, which is hard with acne too, which I know we'll get into later, but people would tend to want to over dry, which is actually doing more harm. So with oily skin, still a good, you can do a hydrating serum with hyaluronic acid, and you could even do like a light moisturizer over top.
So I want to talk about another thing that plagues me, and I know it plagues some of you because I had tons of questions about this topic. Adult acne. Ugh, it's so frustrating.
I see it a lot.
I didn't even have this issue when I was a teenager. Why is this happening to me now? It's so frustrating. So I need the information on how to handle this the best, because sometimes it is just like a war zone happening, and I just feel like I can't stay above water.
First of all, statistically, about 53% of women over 25 have some form of breakouts or adult acne, so just know you're not alone.
We're in it together.
I see it a lot. So some of the best ingredients to help with that are salicylic acid, glycolic, there's benzoyl peroxide, which I don't usually recommend for every adult acne. That one's more for kind of teen, but where it starts to get tricky is a lot of it's hormonal, so it could be birth control and premenstrual, things like that. So some of it's hard to keep at bay, but definitely diet and exercise can play a huge part too. So once all those are taken care of, it's better to kind of customize it when you're adult. So you're trying to balance out again the hydration and over drying. You don't want to do that. Plus, you don't want to have breakouts and then super dry, peely skin, because that's annoying and it's just all these issues. So definitely something with salicylic. Salicylic kind of gets down in the hair follicle and kind of deglues everything.
Oh, okay.
And with a breakout, it's dead skin cells and oil that get trapped in the hair follicle. So you definitely want to exfoliate. Retinol is another really good one that helps. It's proven to help breakouts, but also anti-aging. So it's kind of killing two birds with one stone.
I like that. Multi-use.
Yeah. But then I like to have my clients definitely on a moisturizer or some kind of hydrating serum, just to help balance things out. So yeah, it's definitely good to have somebody kind of helping you customize it also, instead of just being like, here's what I need, I'm going to get everything dried out, because that can backfire.
Yes, which I have been guilty of.
Right.
And then picking.
Yeah.
I've been guilty of doing that, but then I scar, which again, you look at my skin and it automatically scars because it just is made that way. And I'm sure as, you know, someone in this field, you're like, don't pick your skin like that, right?
Yeah. Oh, and I preach it, and there are times that I do it. I understand how hard it is.
Yes, it's hard. You can't go out in public sometimes like that.
I know.
You just gotta get it done.
Like there's a little voice that's like, it'll be okay, and it never is.
It's never okay.
It's never okay.
Yeah. Now, you mentioned the oil getting trapped in the dead skin in the hair follicle. Now, I don't want to get into this too much right this second because we're about to talk about these types of things, but you recently did a dermaplaning treatment on me, which that's scraping dead skin cells off, right?
Yes.
So could that possibly also help with the prevention of future breakouts?
Yeah, so any type of exfoliation, and a lot of times when people hear exfoliation, they automatically think something that has like beads or something in it, but you really want to be careful because you can, like St. Ives body scrub, you don't ever want to use on your face. Some things can be too rough for the skin.
Yeah.
So even like a good chemical exfoliation with glycolic, lactic, or salicylic, and then, you know, like microderm or dermaplaning and retinol. So when you think exfoliating, don't necessarily think something with like beads or scrubbing it with.
That's exactly what I think about. Because that's what we've been taught since we were little kids, that you need something rough to just scratch your skin.
And it's okay on the body, but I mean, I worked with a nail tech that said they use St. Ives body scrub on the feet. So, and it's so much thicker and more tough on your feet. So you have to use that.
Lesson learned, because I've also used that too. You mentioned something about, what was the acid that's in a lot of teen products?
There's salicylic, and then there's benzoyl peroxide.
That one. Now, I've been told, and correct me if I'm wrong, but I've been told that a lot of those, like Neutrogenas and Clearasil, are not necessarily good for adults.
Right.
Is that true, not true?
Yeah, it kind of depends too, because it could be maybe you don't need the benzoyl peroxide, but because you have the adult acne, you're like, well, let me go get that because I've heard. So then that's where it can overdry. So that's where you kind of have to be careful. A lot of them I feel like are aimed more towards teenagers that produce more oil, and so when you get into adult acne, it's a little, you kind of have to play it safe.
It's a different ballgame.
Yeah.
Well, your skin's different, your hormones are different. Like there's so much that's different about you versus when you were a teenager.
You're so more stressed out, you don't sleep as well, and yeah, so all these things.
Adulting.
I know.
Adulting is tough.
We didn't sign up for this.
No. I definitely didn't sign up for adult acne. I know I didn't sign up for that. That can be checked at the door. With stress and lack of sleep, all of those things. We mentioned dermaplaning a little bit. I want to go back to that and just procedures in general, because other than products, there are other things that can be done that can attack these issues that we're having, whether it's acne scarring or dryness or whatever it is. So you recently did the dermaplaning on me and microneedling, which I'm hooked now. I'm absolutely obsessed. I can't wait to have my next session. But for those of you that don't know what microneedling is why don't you just explain that a little bit so that they can know and they can also be obsessed with it.
Yes. So microneedling is known as collagen induction therapy. So
that just sounds fun.
I know. So as we age, our collagen doesn't work like it's supposed to, and so this kind of creates a wound in the skin, and it forces that collagen to kind of rebuild itself. So you're using your own. It's using your own collagen. So it's kind of working at a deeper level. Now, people with the deep scarring, they'll probably see results, I feel like, first. But it's so good for long-term anti-aging and things like that, because you definitely want to keep everything kind of... Yeah.
When you think about staying youthful, collagen, just collagen production and collagen, you just hear that word all the time. So anything that says, you know, collagen inducing or production.
Right.
You want to be on that bandwagon
And
for
for the
sure.
people that don't necessarily want to, they want to do Botox and filler, but they're like, I don't want to spend the money yet, or whatever the reason. Microneedling is good to start with. Facials in general can be good to start with, because you may think that one thing's your problem, but a lot of people think they're dry and need a moisturizer. A lot of times they're really dehydrated, which can kind of lead to other things. So yeah, it's good to have somebody to check it out and figure out what's going on.
Yes. Love that. Someone knowledgeable like you.
Yes.
Now, other than microneedling and dermaplaning, are there any other procedures that stand out that is, before you go the Botox or fillers or lasers route, that you would recommend being a good middle ground?
I love chemical peels.
Okay.
And there's different ones that can kind of target different things. Glycolic is typically a good for anti-aging, breakouts, and all of it kind of helps with sun damage or scarring just because it's exfoliating. But yeah, so chemical peels are always good. And I know a lot of people when they think chemical peels, they automatically go to, you have like 4 days of downtime and look like a burn victim, but there are some where you can, you're not even red by the time you leave here, and you don't have much peeling. So yeah, there's different levels of peels that you can do. And you can do it in conjunction with the dermaplaning too.
Oh.
For best results. Yeah.
Oh. I tell you no lie. Dermaplaning, I already knew microneedling was going to be fabulous. Dermaplaning,
It's like a game changer.
where has that been all my life? I never had my makeup go on so smooth.
Yeah.
Like, that is no joke at all.
It's addictive.
Oh my goodness.
Yeah.
And so how often can you come get that done? Because I already want to come get my next one done.
I usually tell everybody every 4 weeks. You can do it as early as 2 weeks, but typically most people do it every 4 weeks.
Okay, so now I'm here with Stacy, and Stacy also works here at Bodylase here in Cary, and she is a licensed physician's assistant, and she's the one that will handle all your Botox and your fillers and your lasers, all of that like nitty-gritty medical stuff that you really, really want to know, right? So, Stacy,
Yes.
Let's start with Botox, because Botox is one of those things where it's a huge discussion, like, do I need it? Do I get it? Is it safe? Yada, yada, yada. So let's start with what Botox is and just clear the air.
Okay. So Botox is the �R1 treatment in aesthetics in the country. And what it is a big fancy word, neuromodulator. And what a neuromodulator does or is something that relaxes muscles. So we hear botulinum toxin, that's the basis of Botox. Where it's actually a purified protein, so it's not actually toxic, it's no live bacteria, but it's a purified protein that we inject right under the skin, directly into the muscle, and it relaxes that muscle to reduce the appearance of wrinkles and fine lines.
Therefore, making you look fabulous.
And younger.
And younger. I've been noticing like little, I guess you call them crow's feet or laugh lines there, and
Yes.
so this whole Botox conversation is quite interesting to me right now. That leads me to the next question. Who do you look for, or maybe not who do you look for, but who makes a good candidate for Botox? Is there somebody that would be more applicable to it versus somebody else, or is it just whoever wants it?
So a lot of times it's based on what you look like when you're looking in the mirror. So Botox is going to address what we call dynamic lines. So those are the lines that you see when you make facial expressions. So when you frown and when you lift up your eyebrows and when you smile, the lines that you see when you make expressions, those are the lines that we're chasing with Botox. So the opposite of dynamic is static. So the lines that are static or that are wrinkles that you see there when you don't make expressions, those are not what we're looking for when we're treating Botox. Although those can soften and smooth over time when you're consistent with your Botox. So it does eventually work for that as well.
Gotcha.
So really Botox, anytime. So typically I see people, in their late 20s all the way up to 60s, 70s. And like I said, we're treating those dynamic lines. Some younger people do it more for preventative measures because they don't want those static lines to develop. So they're just relaxing that muscle before those deep-seated static lines start to occur.
So you don't even need to actually see them there and then be this huge indentation in your face yet. I
No.
love that it can be a preventative thing.
It can.
So you can start as early as you want. There's no minimum age, I guess?
Well, typically in your late 20s is kind
Yeah.
of when you're starting, because you do want to see those lines when you're making expressions, those dynamic lines.
Okay.
So if you've got no dynamic lines, then where are we going to put your Botox?
Right, that makes sense.
So you want to see the dynamic lines at
Okay.
least with
So you're
facial
looking for that.
expressions.
Okay.
So, yeah.
Okay, so another thing that often gets confused is people think that Botox is the same thing as a filler, but those are totally different things, right?
Totally different things.
So explain to us a little bit about what a filler is.
Okay, so filler is made out of, most of them are made out of hyaluronic acid, so that's something that's naturally occurring in our skin that creates and restores moisture. And what it is a gel form of hyaluronic acid that's injected into the skin in certain levels of the skin, or layers of the skin. And it's used to restore volume. So we use it in the mid-face to kind of augment or restore volume in the cheeks for people who are older and you're kind of dealing with that sagginess. We use it to restore volume in lips. That's like a very, popular procedure is like augmentation with filler. In other areas of the face where we're really looking to restore volume. So it's actually similar to an implant. It goes under the skin and it can last anywhere from 1 to 2 years, depending on the product.
But I like that it is not an implant in what a traditional implant, like what you think of.
Right.
I feel like it's a safer
Yes.
procedure if you want to, achieve volume in your face versus
Yeah.
something else.
Yeah, I mean, hyaluronic acid is also, it's already naturally occurring in your skin, so there's very little risk of reactions. It does draw in fluid, so you can get swelling typically after a procedure, but it's just used to restore volume in certain areas of the face.
I have seen some of these results and sign me up, please. Well, I've noticed as I have aged into my 30s that my face is losing the volume that it once had in the cheek area. So,
Exactly.
I mean, it's good to know that I have options in the event that I just can't stand that anymore.
Right.
And it's an option that I still feel is safe, that my body is not going to freak out. I'm not going to be worried about, some major side effects or anything like that.
Right.
So that's good to know. We need options. Ladies, we need options and we
Yes.
got them.
And you want to try to avoid the knife for as long as possible, so at
Yes.
least we have a lot of options to prevent us from doing that.
I love that too. I think that's so important because a lot of times we think we need to resort right to surgery to get any kind of major result, and that's just not the
There's so
case
many better
anymore.
alternatives.
Yeah. You also do lasers.
Yes.
Now I want to talk about what that even means because I just said lasers and because I've heard that can help with things like hyperpigmentation, maybe some scarring. Is that true?
It is true. There are a variety of uses for laser, and there are lasers basically based on wavelengths, and the wavelength determines what area we're treating, or what we're treating, the target that we're treating. So it can range anywhere from laser hair removal, is one type of laser, and then also we've got lasers that can address pigmentation, like blood vessels, rosacea, redness, or pigmented lesions like sun damage. And then we have lasers that can actually rejuvenate and help with fine lines and retexturizing skin, including scars.
That's awesome. I am one of those that suffers from adult acne from time to time, and so that scarring, and you look at my skin and it scars. Like, that's how sensitive my skin can be. So I love the idea of having something like that done just to remove all that damage, because I don't want to feel like I have to go outside with makeup on all the time.
Right.
That's just,
Yeah.
we don't want to do that all the time.
Correct.
So that's a good option to have.
Yes, laser's a great option for all of those things.
Well, thank you, Stacy. You were very informative, and we're all going to be signing up for Botox now, right? I appreciate your time.
No problem. It was nice talking with you.
We have so much good information, and I am so thankful to not only Tiffany but Stacy as well for sharing all of the knowledge. And I hope that this has shed a little bit of light on just what you think you should be doing, or who you should talk to, what you should include in your routine, or even to start routine, really, because if you were like me, I was so in the dark with all of it. So I needed to be, my hand to be held, baby steps, just and to be taught, really. I just needed to be taught what I needed to do, because this is not my field of expertise. That's why I find people like Tiffany to teach me these things. So thank you again for all the questions, And maybe this could be an evolving thing too, as we come up with new and exciting information that we want to share, then we'll just keep adding and keep adding to the videos. Well, thank you so much for watching. See you next time.
Yay!
Yay! And that's a wrap.